Welcome to the Southwest Utah Health Podcast. For the nearly 300,000 people living in the region, public health is the ounce of prevention that's worth a pound of cure.
Today, our special guest here in the studio is our own health officer and director, Dr. David Blodgett, and we're going to highlight a very important topic today that you're going to be hearing more about from us as a health department, and that is the vital importance of sleep. Glad to have you with us, Dr. Blodgett, today. Why the emphasis on sleep right now?
This was an issue that we haven't addressed as a society very well. I think we kind of all know it, but as far as paying attention to it, and particularly in the public health side of things, our goal is to help people live healthier lives. And if you don't have this component of sleep in place, and in some ways it's the rest of the stuff we talk about doesn't mean a lot if you're not getting sleep. And so I felt like, and I think we all have at the health department, that this was an area where we could really offer some things to people that they hadn't really thought about and bring some attention to the importance of it, and hopefully get some opportunity to impact wide scale the way they think about this and how they approach it.
When you mentioned sleep affecting all the other stuff we encourage people to do, some of that other stuff includes certain pillars of health that you've discussed. Those of us that have worked with you at the health department the past several years have heard you talk about. It started off with the big four.
So first is eat your 4 1-cup servings of fruits and vegetables every day. It's about 18% of the population eats their 4 cups of fruits or vegetables every day. The second thing is not smoking, which as a society we're doing better because we've had big pushes around this. If you go back to the 1950s, 60% of the adult population smoked. Now we're in the 20% range, but still 20% is too high.
Yeah.
Down here in our area, it's about 10%. But unfortunately, we're seeing that go a little bit in the wrong direction. We were at 8%. And then you ask questions, well, what does that mean for vaping and those kinds of things? And that's a whole different discussion, but not smoking particularly. So it's still the number one cause of death in America, 40,000 deaths every year from smoking. Third is exercise. Get your 150 minutes of exercise per week. So it used to be do 30 minutes a day, 5 days a week, but now they're saying, look, as long as you can get 150 minutes, we'll take what we can get, right? So then the question is, well, how many do that? And that's about 22% that get that 150 minutes of exercise. And then the last is maintain a healthy body weight. So this is where we see this generation that's graduating from college now will be the first generation in the history of America that will die at a younger age than their parents if current trends continue. And that's largely due to this obesity epidemic that we're in. So a third of Americans are obese. Another third are overweight. So 2/3 are obese or overweight. About a third are within normal weight. When you ask the question, how many people do all 4 of those big 4, you end up with about 6% of the population. And it hasn't budged really over the last 20 years of my career.
It's like the few, the proud, not the Marines, but the people that are doing the big 4. But when you talk about it, think if we would have asked people, what do you think the big 4 are? Most people would have probably nailed those. They would have guessed those: diet, exercise, that type of thing. I've heard some people say modern culture is sometimes unhelpful with those things because of the American diet, the availability of ultra-processed fast food, convenience food, almost too busy sometimes, overscheduled. And not that it's even bad stuff. I mean, we live in a day and age where there's so much available, not only because we're a prosperous society generally, largely because of public health. That's why we're a developed nation. But we have maybe almost too much of a good thing with interests, activities, food, entertainment.
Well, and when you think about how much of our culture is based around food, and then I think this tendency to go overboard. So the moderate approach is to make sure you eat some more fruits and vegetables in your diet. The idea is towards a more balanced approach to nutrition, and the more fruits and vegetables you add, the more vitamins and minerals you get.
So more fruits and vegetables, regular exercise, you said 150 minutes, which is about half hour a day for 5 days out of the week. Not smoking, which it sounds like that's the one most of us are not doing.
Yeah, we're doing better on that.
And then maintaining a healthy body weight. Now, part of me would ask if you could even pick one of those, which is the most important. Right now, I know you'd say, well, none of those because you're going to add 5.
Yeah, I mean, if you take those 5 as like a stool, the foundation on which that rests is this other one of sleep, because the studies show that when you're not sleeping well, when you're not getting enough sleep, then none of those happen. You're much more likely to make poor food choices. You're less likely to exercise. It's very difficult to maintain a healthy weight and even make poorer decisions with things like smoking and how much you drink alcohol-wise and things like that. And so it all cascades together to make it more difficult to live a healthy life. So that's one part of why sleep is so bad, and then the other parts of it too. So you could almost call that the foundation principle of doing that, then the rest of it doesn't happen. So.
In fact, you mentioned that. I read these quotes introduced in our magazine in this radio show last week. I quoted old quote from a pastor, Edward Everett Hale, way back in 1892, where he says, "Sleep and enough of it is the prime necessity. Enough exercise and enough good food are other necessities, but sleep and enough of it, this is a necessity without which you cannot have the use of exercise or food." So he just has a list of 3: exercise, food, and sleep. He says sleep's the most important. And the American Academy of Sleep Medicine just 2 years ago said kind of the same thing in more of a modern terms. They said, along with nutrition and exercise, sleep is one of the 3 pillars of a healthy lifestyle. Healthy sleep is vital for your physical and mental health. And so again, this isn't a surprise. People aren't saying, what, we need sleep? Because, you'll die without regular sleep. So all of us sleep, unless we have some sleep disorders that steal that away from us. But we are probably robbing ourselves of sleep. In fact, in your introductory article, Dr. Blodgett, it mentioned in their study, it was shown that 30 to 40% of American adults are chronically sleep deprived. And article following that, called Wake Up to Sleep, mentions that a good portion of those, it's either because you have a medical sleep disorder like apnea or restless leg syndrome. Bulk of the other is voluntary sleep deprivation. We don't even realize we're doing it to ourselves because our bodies are resilient, we get used to it. But our cognition, our ability to reason, concentrate can really be affected.
Yeah, we're the only species of animal on the earth that willingly deprives ourselves of sleep. Everything sleeps. Even when you look at single-cell organisms, they have kind of a restful state that mimics sleep. There's something about that we all need. And yet we're the only ones that have decided that we want to deliberately sabotage that effort to keep us healthy.
So why did you add number 5 to that 4-legged foundation of sleep?
Probably should have been there to begin with, right? And it really turns out to be a factor that allows the rest of that to work. If you're not sleeping, then really you can't expect the rest of those to fall into line. Now, the fatigued brain makes poor decisions, lacks motivation. There's just a million reasons why chronically sleep-deprived people are just unhealthier.
Part of this, too, your discovery of the book that you've mentioned to us a couple of years ago by Dr. Matthew Walker, called Why We Sleep. It became a New York Times bestseller. It's written for everyone, but he doesn't shy away from scientific studies where some people might say, this isn't necessarily an easy read, but it's a very fascinating, compelling read. Yeah. Is that one of the factors coming across this book? Did that sort of spark something in you?
Well, yeah. I'd even given lectures about sleep and things, but then you read that book, the entirety of the book, lid to lid, and you realize, man, I have blown this in my life. So I think maybe we would all say that, but we call it the aha moment where you realize, this isn't just talking about general stuff. This is talking about me and what I need to do in my life. And you have to make that transition where you say, I know it's not good for me to smoke, but I'll do it sometime too. I am going to do what it takes to make this happen in my life. And so I really think in the sleep arena, we all kind of intuitively know sleep is important. I don't think the information has really been widely available of just how important it is. So hence this magazine and the efforts that we're making to get the word out.
Right. So at the end of the article, you summarize it into 4 bullet points. Number 1, that you say sleep is critically important to your health and almost every aspect of your well-being. That includes mental health as well.
Very much so, yes.
You say about 40% of us are sleep deprived, largely due to bad habits. And the question is, does this mean you? And I have to personally say, as I was helping putting this magazine together, a couple nights late at night drinking caffeine, thinking, I'm a total hypocrite. So I was realizing that we say a lot of times when our little kids the next day are grumpy or they're whiny, they're extra emotionally sensitive, they're irritable because they didn't get enough sleep. And we think somehow becoming adults, we're the exact same way. This message applies to a big chunk of people, either those of you out there listening or someone that you love. Thirdly, you say there are methods you can implement or learn that will improve your sleep, and we cover some of those in the magazine. And then finally, that sleep can be a complex issue that requires patience and a thoughtful approach on your part. Even though we're involved in public health, it really comes down to individual responsibility, right?
Ultimately, it all comes down to that, right? We can't force people to do any of this. And sometimes I think we get this idea that government can fix all the problems of the world, and it's just not reality. In this case of public health, it always is better when we educate and encourage and put out the ideas and let people figure out how to make that work best for them in their lives. But for me, and if we want to make that a personal thing, it really took me on a personal level taking to heart the idea that I can't continue to treat sleep lightly. I need to be more serious and thoughtful and intentional about what I do with sleep.
You're going to hear a lot more from us at the health department and from Dr. Blodgett on the importance of sleep and also breaking it down into specific things, range. And that, of course, averages out to about 8 hours of sleep a night. And then there can be adjustments based on differences. It's also important that it's around the same time every night so that it's consistent, not only at the time you go to bed, but how many hours you sleep. Bottom line, we hope everyone out there takes the opportunity to make this a big priority in your life.
This podcast was brought to you by the Southwest Utah Public Health Department. For more information, visit swuhealth.gov.